In this session, we are going to discuss about the principles of MRI. Principle: MRI makes use of magnetic property of certain atomic nuclei. Hydrogen nucleus, that is a single proton nucleus present in water molecule and therefore in all body tissues. So it is generally found in the human body. So generally, the hydrogen nuclei partially aligned by a strong magnetic field in the scanner. Okay, the nuclei can be rotated using the radio waves and they subsequently oscillate in the magnetic field while returning to equilibrium. Okay, but simultaneously they emit a radio signal which is detected using antenna or coil. Very detailed images can be made of soft tissue. Okay, so before applying the magnetic field, the protons or the protons arranged in a random manner in the hydrogen atom. But after the strong magnetic field applied, some of the protons are aligned in a direction. So the components of MRI are scanner, computer, and recording hardware. Okay, an MRI scanner is a large tube that contains powerful magnets. Main component of scanner are static magnetic field coil. Second one is a gradient coil. Third one is the RF coil. These are the three coils that are basic component of the scanner. Okay, so static magnetic field coil, there are three magnets to generate magnetic field. First one is a fixed magnet, second one is a resistive magnet, third one is a superconducting magnet. Fixed magnet and resistive magnet are generally restricted to field strength below 0.4 Tesla. High resolution imaging system use superconducting magnets. Third one is a file. The superconducting magnets are larger and complex. Okay, they need the coils to be soaked in liquid helium to reduce their temperature to a value close to the absolute zero. So it is soaked in a liquid helium to reduce the temperature to a value close to the absolute zero. So gradient coils. Gradient coils are used to produce deliberate variations in the main magnetic field. There are usually three sets of the gradient coil, one for each direction. The variation in the magnetic field permits localization of image slices as well as phase encoding and frequency encoding. The set of the gradient coils for the z-axis are Helmholtz pair, and for the x and y axis paired saddle coils. Radio frequency coil. RF coil act transmitter as a transmitter and receiver. RF coil are antennas of the MRI system. Okay, that transmit the RF signal and receive the return signal. They are simply a loop of wire, either circular or a rectangular shape. Helmholtz pairs or coils. A coil consists of two circular coils parallel to each other. Okay, they are used as the Z gradient coil in MRI scanner. Okay, paired saddle coil are also used for the X and Y gradient coil. Advantage of MRI: no ionizing radiation is used in the MRI scanning. Variable thickness in the any plane, better contrast resolution, many details without IV contrast. that can be detected in the MRI scanner. Disadvantage. First one is a very expensive, dangerous for patient with metallic devices placed within the body, difficult to be performed on claustrophobic patient, that is the fear from the sound or noise, a type of noise. Movement during scanning may cause blurry images. RF transmitters can cause severe burns if mishandled. Okay. The different shapes MRI scanner are available for MRI scanning. Like first one is the closed MRI, second is the open MRI, but the MRI that is used in generally a closed MRI. Upright MRI or functional MRI is the early 1990s EMRI or fMRI had come. fMRI is based on the same technology as MRI. fMRI looks at blood flow. It is a technique for measuring brain activity. It works by detecting the change in blood oxygenation and flow that occur in response to neutral activity. So this is the type of functional MRI that is used since the 1990s. Namaste. I JVWU Gaurav from the Faculty of Physiotherapy and Diagnostics at PG in the Department of Diagnostics and Radiodiagnosis in the discipline Radiology. Working in Jayoti Vidyapeeth Women's University, Jaipur. Today we are going to discuss a discussion of magnetic resonance imaging. Magnetic resonance imaging in that is included in the post hospital administration in radiodiagnosis in BScRT system. That we discuss about the magnetic resonance imaging. It is purely based on the NMR, NMR, nuclear magnetic resonance. It is the principle of the magnetic resonance imaging. MRI is a test that uses powerful magnets, radio waves, and a computer to make detailed pictures of the inside of your body, inside of a patient body. The doctor can use this test to diagnose the patient or to see how well the patients are responded to treatment. Okay, so they used to know about the to know or to diagnose the patient and how the patient is responded to the treatment. That is also be clear in the MRI test. Unlike the X-ray and computed tomography, the MRI don't use the harmful ionizing radiation of X-ray. The uses of MRI and MRI magnetic resonance imaging helps a doctor to diagnose a disease or injury, and it can monitor how well the patients are doing with the treatment. MRI can be done on different part of the patient's body. It's especially useful for looking at soft tissue and the nervous system. So the dense for diagnose the dense material in the human body, like bony cavities, like thoracic cavity and brain, in case of brain, in case of thoracic cavity, there is a cavity that is surrounded by the bones. So bone can't be detected in the MRI through the MRI, but MRI can detect a disease in the soft tissue and nervous system or brain and the vessels in the vessels. An MRI of the brain and the spinal cord can help find many things, including first one is the blood vessel, including first one is the blood vessel damage, second is the brain injury, that is the cancer. Okay, it is used to diagnose a tumor or cancer. Okay, any brain injury, any blood vessel damage like blood vessel rupture or vessel, any injury in the vessel, any leakage, any obstruction, any type of embolism. Okay, multiple sclerosis. Okay, spinal cord injury, any injury in the spinal cord, stroke, eye problem that is related to the brain, inner ear or problem. Okay, so an MRI of the heart and blood vessels looks like. So MRI of heart of blood vessels, the use of the MRI heart and blood vessels are: first one is the blocked blood vessels, second one is the damage caused by a heart attack, damage caused by heart attack. Okay, so it can evaluate or it can detect the blood vessel that is blocked or damaged caused by the heart attack, any heart disease related to valve, related to chamber, related to any other obstruction, problems with the structure of the heart. So an MRI of the bones and joints looks for bone infection, cancer, okay, damage to the joints, disc problem in the spine, neck or low back pain with nerve sign. So an MRI can detect the bone deformity like bone infection, any infection in the bone, any cancer or tumor, any damage to the joints, okay, any type of disc problem in the spine, okay, neck or low back pain. Okay, these are the MRI indications in respect to the bones. Okay. Okay. So in this session, we had discussed about the uses of MRI and uses of MRI. So MRI is also a technique of a radiology technique. It uses magnetism, a radio wave, and a computer to produce an image of a body structure. MRI based on the principle NMR nuclear magnetic resonance. Okay. Uh, uh, what can be diagnosed by MRI? Okay. cases or disadvantage in which the MRI is contraindicated or it has a disadvantage of MRI imaging. First one is the cardiac pacemaker. In the case of cardiac pacemaker, if a cardiac pacemaker is placed in the heart, then it is contraindicated. Second is certain clips in your head from the brain operation, a cochlear implant, a metallic foreign body in your eye. In the patient's eye, had surgery in last 8 weeks. Then MRI investigation is contraindicated if the patients are pregnant. MRI makes use of magnetic properties, certain atomic nuclei, hydrogen nuclei, single proton present in water molecules and therefore in all body tissues. A hydrogen nuclei partially aligned by a strong magnetic field in the scan. Okay. Thank you. The session is over. I think you all satisfied with the session. If you have any query, then put it into the comment box. I will resolve it later. Thank you. This session is powered by Digital 2.0, JVWU University, Jaipur.